Vikki Petersen, founder of Health Now Medical Center and co-author of the book, The Gluten Effect. Today's question is a great one, and it is, can mental illness be hereditary? I love this question, and let me tell you why. Because I emphatically feel the answer is no. From this viewpoint, not to say that you don't see a stream of symptoms and or illnesses coming through the family tree. Obviously that is the case, and I think one that most of us or many of us see in our own families and in other families we know. So I'm not meaning it that way. What I am meaning is that from the degree, meaning that if it's hereditary, I'm stuck with it because I can't change my genes. This is the way I am. It would be like a blonde, blue-eyed family complaining that they had blonde hair and blue eyes. Nothing they can do about that. What's exciting is that there's a lot you can do about the various diseases that are coming through your family tree. I hearken back to my own experience where when I started getting migraines, when I hit puberty, I was told, your mother has migraines, you have migraines, that's just the way it is. So I cured my migraines and then cured my mother's, and that was the end of that. Our genes didn't change, but the underlying root cause is what did change and what needs to change. Getting back to genes for just a moment, we're realizing that our genetic expression is much more plastic than we ever thought. We used to think genetic expression was like eye color or hair color, and it was very definitive, it was very hardwired, and not a lot you could do about it. What we're discovering now is that the way genes are expressed through how we eat and the nutrition that we give the body is more plastic, so we really can change genetic expression based on how we treat the body. So getting back to depression, what we have seen clinically in our practice, I recently attended an Institute for Functional Medicine conference that was all about depression and mental illness, and it was agreed upon by clinicians across the world that this genetic idea was really one that was very outdated and frankly untrue. So our clinical experience here at Health Now is very validated by these doctors from around the world. So what do we need to look at in families who have depression or in families that have any sort of disease that is coming through the family tree? Is that underlying root cause? If you've read the book, The Gluten Effect, if you have not, I can tell you that what we see with gluten sensitivity is that the first system that's affected very commonly is the digestive tract, which makes sense because gluten is in the food that we're eating. But the second most common system affected is the nervous system. So patients suffering from depression, anxiety, symptoms of ADD, hormonal imbalance, neurological pain, lots of different symptoms associated with the nervous system we see associated with gluten sensitivity. So what's exciting is that something that you have seen in your family that's coming down through the family tree, the root cause of that is not to get the symptom, whatever it is. The root cause is something that's perpetuating and causing a certain symptom to be expressed. So it's the expression of that symptom that we want to reduce by getting to the true root cause. In many cases with depression, we find the true root cause to be a food sensitivity. The most common food sensitivity, hands down, is the gluten sensitivity, and it's very, very exciting to see those changes occur. Very often, it almost occurs on a daily basis here at the clinic, is someone saying, I can't believe it, my brain fog is gone, my black mood is gone, how could that possibly be? And not enough time to describe it here, but it is in our book, The Gluten Effect, how this protein molecule affects the nervous system, brain on fire, as some people call it, inflammatory inflammation of the nervous system that occurs that can create these depressive anxiety and other symptoms that I mentioned earlier. So the exciting news is that just because a disease or symptomatology is in your family tree does not mean that you are hardwired to have to live with that. You might have the propensity toward it, Absolutely. But you can do something to really get to that root cause that's setting up your family tree for that symptomatology and alter it. So it is exciting. I hope that helps. And until next time, to your good health.